had to print some stuff, sorry.
No problem.
Yeah, I don't have Allison's phone number.
Have you seen
Kathy, do you have Alice? Can you call Allison? I think she's joining us.
Yes.
It was raining the other day.
I was printing stuff she asked me to print, so.
And then one of the hot girls.
Did you get that?
No, I've got
I
that.
just took everything.
And then she looked at the card and said it must be.
Oh.
Hi, I'm just calling you. because
Oh, yeah,
the board
that'll
asked me to. You're probably gonna be here pretty soon, right?
Yeah.
You must be on the wrong meeting because you don't show up.
Unless you're Richard.
With Justin.
No, this is Darren. Should I not be on
Yeah,
that?
I'll have, can you send the link?
Okay. You can stay, Darren.
Okay, all right.
No, she didn't. Yeah. So Richard.
I was just wondering that myself.
You know, Richard. If there's any water
She's
anywhere.
gonna get you on, so I'll let you go and it's gonna be on my line. Okay, great, bye.
Scooping the water out for measuring.
I don't understand the sandbox.
And drinking it.
And I'm like, oh, thank God.
Oh, you mean good
Oh,
times?
good.
yes, thank you.
Well, that's how we build the community. And then you know, thing on the other hand, it doesn't, you understand how it's, you don't get information. It's a plan,
So I've got.
Recording in progress.
Looks like we had 7. That's better.
What did I do? I'm calling.
So we're just waiting for those of you who are on video, we're just waiting for a minute for our attorney to hop on and then we'll start the meeting.
Okay.
This way, if I hear something I don't like,
Being crunched really loud. Does that work?
it probably is gonna be good. 2 people heard it.
Are you on live?
Yeah.
How do you decide to do live versus taping? Because
When
sometimes.
we were getting so many views real fast on the taped ones that I did.
Oh, yeah.
Plus, we always, well, I have a record of all the taped ones also archived, but this way there's a record that shows that I didn't do any editing other than splicing in commercials or taking out real annoying coughs. There she is.
Oh, there she is.
I made it.
I guess it takes an act of Congress for me to sign in.
All right.
Oh, okay.
Okay, so I will call this meeting to order. Our chairman, Ann Slagle, is not going to be able to make it this afternoon, and our secretary, Nick Johnson, is also not able to make it today. So I'm the third choice. So, all right. Sir, do we have a quorum?
Yes, we do have a quorum.
All right. We will start with our pledge of allegiance and an opening prayer. Kathy, would you lead us in the flag?
Allegiance to the flag of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Nathan, would you lead us in prayer?
I will. Father, please attend this meeting. Give us all wisdom and compassion and justice. In Jesus' name.
Thank you. Next on the agenda is the agenda. Do we have any additions or changes to the agenda that's presented? Hearing none, did you?
No,
Okay.
no change.
Hearing none, we'll vote. All in favor of the agenda as presented?
Aye.
Any opposed?
Do we need a motion? No.
Oh, yeah, skip that part.
I move that we accept the meeting's agenda.
Thank you,
I second
Ted.
it.
Any discussion? All in favor of accepting the agenda?
Aye.
Any opposed? All right. Next on the agenda is the consent agenda. We have meeting minutes for July 2nd and for June 20th special meeting. Do I have a motion?
I move to accept the July 2nd and the June 20th minutes.
Do we have a second?
I second.
Any discussion? Okay. All in favor of accepting the consent agenda and meeting minutes?
Aye.
Any opposed? Okay, motion carries. Next on the agenda is visitor comments. Do we have any visitor comments? Yes, ma'am.
Betty Petroni, and I was just curious, is there any other H&H people that have influence on the hospital now, other than the HR director? No, so all of them are basically gone.
They're gone, yeah.
Okay, that's,
Other than the HR person, but she's even gone right now, she's on vacation, so.
Is she coming back?
She does have a contract through the end of August.
What?
No, that's fine.
Okay, I'm Carol Jones, I'm the one that have been nagging you guys.
Okay.
So, my question is, you know, we raise our people up, we do it locally, and we have all been here at this facility for, I don't know how many years. Piper has been here for over 20 plus years, and all of a sudden now, we have an issue. I find it to be ridiculous. And all the stuff that I've been seeing, it's driving me absolutely crazy. The waste of money, the misappropriation, we're supposed to be caring for our young, but if we're eating our young and we're sending the people that we love out the door, who's gonna wanna come here? I, for one, I'm gonna vote with my feet. I can go someplace else. I can go Gillette, I can go Rapid, I can go. What keeps me here is the love of the people that are here. But when we're losing them and dismissing them and firing them for no reason, that is very concerning to me. Breaks my heart. And what I've seen in the last couple months is killing me. Because I thought this is where my family goes, this is where my son goes, which everybody here treats him so very well, but do I have to look other places? That's what bothers me, because you're gonna lose people, and I'm gonna see this closed just like Fall River, Lusk, all these other places that have been around. Because people will vote with their feet. If you don't care for the people that live here, and we're bringing people in to cause division, we're all gonna leave. We won't want to be here. I come here because I love the people here. I love the people that take care of my son. I love everybody here. So I would love to see Piper back where she belongs. She has done every job in this facility, can do it hands down. She cares about it. If I needed her in the middle of the night when I was working night shift, she was the first person through the door. So that we treat her this way, that we don't say, hey, where are your receipts, Piper? Can you tell us what's going on? You know, what are you accused of? We don't even know what she's accused of. This is ridiculous.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
So that we treat her this way, that we don't say, hey, where are your receipts, Piper? Can you tell us what's going on? You know, what are you accused of? We don't even know what she's accused of. This is ridiculous. But if you treat people like that, you're going to lose very talented people. She grew up here. She went to school. She came back just like a lot of our docs did to serve the community that we love. So, in my opinion, get her back to work. Get some unity back in this facility. She should be getting ready for the foundation breakfast and doing pancakes to raise money for the facility. That's what she does every year. She's done it for forever. So, sorry about my little pulpit thing here, but my goodness, get her back to work. This is ridiculous. This should have been done internally. Somebody should have been talking to her and asked her what her receipts are, and this should have been done a long time ago. So, sorry. And I'll write you again, but.
Thank you for coming and letting us know. Do we have any other visitor comments? Nothing. I had just two things I wanted to say. The first is, I know she's not here today, but I would like to thank Jan Mason for her years of service as a provider to Weston County Health Services. For those of you that didn't know, she's retiring as of July 5th, so she had sent us an email that's, am I right, Kathy? Or did
I
she-
don't
did
know
that
if it's
change?
July 5th, it may be a little longer than that, Kathy, if
I
you
know
get all
she
her
was-
patients. She's trying to get them transitioned, yeah.
Yeah,
But sometime soon around.
yeah, but, yeah, I didn't wanna let it go without saying thank you, to Jan. So, the other thing was, when we were getting ready to tour the pharmacy today, we had a person from the community who came in and gave us some really good feedback that I just wanted to share too. She told us that she came in through the emergency room and she was here today because she just wanted to say thank you for the wonderful care that she received from everyone in the facility. She specifically mentioned the ER staff as well as the people in the lab doing blood draws. She said she knew she had a hard time, but they were all very kind and accommodating, and she said that one of the things she noticed was how well the staff worked with each other, and they said things like, no problem, you know, they encouraged each other, not just the patients, which is a really, really nice thing to hear. So I asked her if it was okay if I shared it at the board meeting, and she said yes. So thank you to everyone who works that hard every day. We appreciate you.
The other thing, if I may, that she did mention was that she had little children. And she came in, basically I kind of took out of it, quote unquote. But the staff stepped up, took care of her little children, stayed with them until there was an adult show up and take care of the children, and she was real appreciative of that service to step in there and help. I also would like to thank the staff for that. That means a lot.
I have a visitor comment if we're still on there. Just following Carol. Hi, Carol. I mean, all of us feel that way about Piper. And every week, every month, this has been going on. People from the community, a lot of our employees have come and voiced their concerns and their feelings. And every week, when somebody gets done talking, you guys are like, thanks for coming, we appreciate it. I mean, is there gonna be a closure ever? I mean, can you tell them you know what, we're working on it and we're gonna try to get this resolved as soon as possible. Every time somebody speaks up, nobody says anything to comfort anyone.
Well, I'd like to say something, Carol. So I've spoken with Piper on numerous occasions, also with them. And because it's very important to me that I understand fully what she wants to see. I've also made every effort I could to make sure that Piper is treated fairly at every turn. It is my responsibility to do what's good for the hospital, and that means we treat everybody 100% fair. So I promise you and the community that my commitment is to treat everybody fairly at every turn. And unfortunately, a lot of this matter can't be discussed publicly. And I wish we could, but we just can't for lots of reasons.
Well, I understand that too, but it just seems real suspect that
It
this
does.
is 3 months later and
Yes, it
we
does.
have no, it's either poop or get off the pot at this point.
I totally agree with you on that point, that, yes. And so I'm in total agreement with what you're saying. And there are things that I have a long list of questions that I'm ready to answer.
Because that's the thing, is like, has anybody talked to Piper? You know, she could probably tell you, this is what I was doing, this is why I was here, because she has worn every hat in this facility.
Right.
I mean, it's not uncommon for her to go down and even feed a patient if it needs to be done. She will go out and above and beyond and be assistive to everybody in this community. So
Right.
I'm just like, I can't believe this, 20 years plus, and now we have an issue.
Yep.
I'm just floored.
Yep.
So that's why I guess I'm so emotional about this, because if you can do this to this person who worked and achieved even her master's in business, I mean, did everything for here. Okay, who else is
Well,
involved?
and I just want you to know that heretofore, I have yet to hear the presentation of the assertions of facts about what happened. I've yet to hear that. So I'm very, very interested, I will be very interested for someone finally to make an assertion of the facts of the matter so that I can look at those and see if they really make sense, if they're really facts.
Well, I appreciate that, because all I've seen is, from what I've heard from others, is the division that was sown into this facility, that everybody they're walking on eggshells and they're scared and they're worried, and why? We used to love coming to work, open the doors, come on in. Piper would sit there on lab draw days and sit there and help everybody get where they need to go. I myself even came through those. But I tell you what, if this is how we treat people, I won't come. And hardly not anybody else, if this is how we expect our loved ones to get treated. So those are my concerns. And I don't want to see the hospital go by like Fall River. It took Fall River forever to get reopened. Took Lusk forever to get reopened, because of mismanagement and having to hire contract staff, yada, yada, yada. So I don't want to see that. I love this facility.
I just want to say thank you for just speaking what you spoke, because I think a lot of us have not heard that. I mean, none of you guys have spoke like that to any of us that have concerns. So and that's all we want. I mean, how much, that probably made half of us feel a little bit better, that, at least we know something's going on.
Yeah, Deb, I just want to say, and I'm the interim CEO in the room, but I am from Wheatland. I got to Newcastle as fast as I could. But sometimes when we get something brought to us, it takes a while to figure out what happened, and it's unfortunate that's that way. But we're also gagged. We really are not supposed to be doing any kind of conversations about it. This is an HR matter. It's about her privacy as much as it is about the privacy.
An HR person still from H&H?
No, I'm not talking about the HR person
Okay.
from H&H. I'm talking about in human resources. She's a human being. She deserves the respect of privacy while an investigation is going on. And I mean that sincerely, because it wouldn't be fair to any of us if all of our alleged flaws was out for everybody to be displayed. So I just want to remind us that we can't always talk about,
Well,
these
I
situations.
understand all of that, but to me, this is.
I get it's been a long time, I do.
I was gonna say, I share your frustration
And,
with how
you know,
long this
because
is
right
taking.
now, Foundation, we're supposed to be doing pancake breakfast here coming up, you
We
know?
don't do that anymore.
We don't do barbecue, we don't do anything, so we don't do anything for the community like we
Yes,
used
we
to.
do. We do a haunted trail in October.
So I get your feelings, I'm trying to just let you know that we protect Piper in this process too. So I get your feelings, I'm trying to just let you know that we protect Piper in this process too.
Well, I understand that, I
Okay.
just feel it's long. And Nathan, I appreciate you, I appreciate everybody on the board, I do, I really do. But I just feel like, wow. If, you know, this is what we do to our own, it's very difficult to get people here. You know, and you can't get a person like Piper that has grown up here and has filled so many roles and has pursued education to benefit us, that you can't find enough people to fill what she does. Or, that she could be doing if she's back at work. So,
I hear you.
yeah. And so I'm sorry, I'm just briefly here, I'm usually over the road truck driver, but I have been following everything. I have been following you guys on everything, and the Zoom thing with the pornography was awful, let me tell you that. That was so bad.
And I think everybody understands and respects that you guys can't talk about anything, but just to even just talk about it and say, you know what, we can't talk about it, it is taking a long time, we don't understand, makes us feel better. Nobody has said
Just so you know,
anything.
it's a little bit hard, especially, but really for all of us, we are a pretty young board. But for the ones of us that are brand new to the board in the last couple of months, it's pretty hard for us to know what we can say. And so maybe we're erring on the side of being cautious by not responding too much.
We really can't say much.
Yeah,
We
I mean,
really cannot.
and I don't want to mess that up, right? I fully understand the concerns. I empathize with them very much. We're trying to balance knowing what we can and can't say. So,
And that's understandable, but I think all of us here can say this is the first time we've ever heard anybody say that.
Anything.
Yeah.
The first time.
I was investigating how to recall already, because I'm just like, it's moved all along.
Yeah, if it was one of your employees, you would not be talking to other people about it.
Absolutely, and I
Right, so-
respect that.
So really, there's nothing to be said. There really isn't. I'm happy that Nathan wanted to speak up, but I'm really telling you, there's nothing to be said because it's an HR issue.
And
Okay?
I understand that.
So silence is part of the process.
That's hard on us too.
Yeah.
It's very hard, because we all get phone calls, we all get the emails. It's hard to visit with somebody that wants answers and you can't give them.
I don't really want the answers, I just want to see her back at work. So, it's like, let's get this resolved, That's what I'd like to see. I don't want to lose anybody like that, because you can't get people here. Usually this is, you're getting people because their husband might work up at the concentration of the camp here, or something like that. You get them just by chance, you might get a nurse or a nurse's aide or something like that. You can't hardly get people here, and then we're gonna eat our own? It's crazy.
Thank you for your thoughts.
Thank you.
Well, I have another
Anyone?
question. Yeah.
Ma'am.
So you said that the HR has a contract till August. So do we have to keep her till August, or is people, you
Well,
said you got a new recruiting.
What I'm doing right
team.
now is working with a strategic impact. Actually, Tony's here tonight, Tony Blake. He's from Colorado, and we've already got some candidates that we're in play with interim with a CHRO candidate. So part of the challenge with the departments right now is like right now while she's gone, I'm literally the only administrative person. And I took the job on, okay, but there's a lot of HR stuff that goes on around here too. So I'm gonna let the board think about that, what they want to be able to do about that. But,
Well, no, I was just
but-
curious if we had to keep her until August.
Well, as I recall,
I don't
Yeah.
remember.
we agreed to extend her up to 50 working
Yeah.
days.
The motion is
Yeah.
up to.
Up to.
Yeah, up
So
to.
you,
So she-
so if you find a
Right.
If we hire
candidate, you
someone
can
else,
get,
yes.
then she would be gone.
Yeah.
Yes.
That's what I was worried about. She got to stay at that exorbitant.
Right.
Yeah, well,
Great.
if Kathy hires somebody tomorrow, then that will be.
Thank you.
All right, any other visitor comments? All right, next on the agenda, Kathy?
Well, let's see, this week, the nursing home had a really good survey. The surveyors were here from, I can't even remember now, Monday afternoon until today at noon, they exited. And so we're pretty happy. The only thing that they really paid attention to was there was one person that maybe didn't do their hand hygiene the best way when they were taking their gloves off and then switching to clean gloves again and washing their hands in between. So that was really quite well. There was 2 complaints that they came in on and both of them were unsubstantiated. So that was good news. We had some missing temperatures on our logs. There's an easy fix to that, which is getting some digital temperature pieces that will alarm if we have something going on with the temperatures, and we'll track it every day. So that's a good solution. We did talk a little bit about our administrator, nursing home administrator being out. And I am in the process right now of interviewing for interim, should I need to have an interim nursing home administrator. We also have 2 people in the building, Kim being one of them, and Melissa, that are both working towards having nursing home administrator licenses so that we have some backup strategies relative to that position. I've been to every department, I think, in this time that I've been here. I've had really good reception for people. I think that we're building a relationship together. I do think it helps that I'm a Wyoming native and a Wyoming girl. And I would say that when I look at our quality of services here, we should be really proud. We're a very high quality facility. The Manor's the cleanest Manor I've ever seen, ever been in. I'm really proud of that. Home health is busy, physical therapy is busy, the departments are staying busy, so kudos to the team because they really do a great job here. They make my life a lot easier because of that. We've been working on some pay issues with our changeover to ADP as far as getting the payroll done the correct way. I think this week we finally got to resolution, so we're happy about that. We will be double checking that on Tuesday. My list of tasks keeps growing, but it's nothing to bore the room with. And what else would I like to say? Yeah, I just think that a lot of positive things are happening. I think I like to call it God's in our corner because we're really getting candidates pretty aggressively in the last week. And I thank Tony for the work that he's done to be able to do that. And these candidates are people that have worked in critical access hospitals and really understand critical access. So pretty excited about that. That's my report.
Thank you very much. Does anyone have any questions? Thank you, Kathy. Next on the agenda of strategic initiatives, first is Finance Committee report. I just had a couple of things. We still have no reports. We do have Finance Committee on Tuesday. Usually it's the Tuesday before the board meeting, but because we moved the meeting, it's the Tuesday, this coming Tuesday at 4 p.m. So I'm hoping that maybe you'll be able to get with your staff to have some
Yep, we'll be there.
reports and
And I'll be there as well.
utilization
Yes.
statistics. As far as utilization statistics, I just took the emails that we had received and I kind of summarized them on this sheet if anybody wants a copy. we did get a report from radiology from Keisha, thank you very much. So we have the utilization statistics for radiology here. We did get a report from Donalda, thank you Donalda, in both May and June, with reports on admissions, long-term care days, emergency room visits, which is summarized on the report, and we appreciate that as well. A pharmacy update from Joy. The medication packager project is well underway, and you expect delivery in mid-September.
Yeah, the end of September will be coming.
So hopefully after Tuesday's meeting, we'll have some more financial statistics, but that's all that I had at this point.
And we got a verbal report for physical therapy today when we went through, so that was good.
Yes.
Yeah.
If I may add to the financial report, Keisha, they come out, that she received she calls it a small grant, but in no grant, small grant. And I want to congratulate her, thank you.
Yeah, thank you.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
She calls it a small grant, but in no grant, small grant. And I want to congratulate her, thank you.
Yeah, thank you.
All right, and that's the Finance Committee report. Next on the agenda is approval of bank signatures, Kathy?
Yes, I need permission for myself, Alicia Grimm, Jamie Dowdy. I need the full access types of pieces. The rest of these just need to be able to get in and look at the accounts. Alicia Grimm, Jamie Dowdy, and Kim Lovejoy for information only for them. And I do not have the paperwork because Sandy didn't get it to me, but would like to get the vote for approvals if I could, so that I could get the paperwork going.
Can I ask a question?
Sure.
Are we gonna make sure that Randy is no longer on the?
Yes, that's
signature
part
cards?
of it, yes.
Okay.
Do you want to put that in the motion?
Yes.
Jamie Dowdy and Kim Lovejoy, are
They work in the business office, yeah.
I move that we go ahead and get paperwork for the bank signatures, give Kathy the authority to sign those, and for access, or you need to sign the checks too.
Right, sign a check, signing signatures for me.
And Alicia Grimm
Mm-hmm.
and Jamie Dowdy to have access to information.
And Kim.
and Kim.
Kim, and Kim.
And those, would you mind adding to your motion that Alicia Grimm, Jamie Doherty, and Kim Lovejoy would be given access to only the accounts
For
that they are
information.
required,
Mm-hmm.
that are required for their job?
Yeah.
Not all of the accounts.
Yes,
Is that
are
correct?
required for their job.
Got it.
Do you want me to start the motion over, or clear what I was?
Allison got it?
Allison? I got it.
Okay.
Okay, all right.
I'll second the motion.
Okay, any discussion? All in favor of Ted's motion to grant access to bank accounts as indicated?
Aye.
Aye.
Any opposed? Motion passes. So I have two providers for credentialing, Dr. Vu, who's with Louisiana Neurology, and then Dr. Zimmerman, who's with the ER providers. They were approved by MedStaff, and then our two quality looked at them today.
What was the name
look at them last. Oh, yeah. Just be you. Yep. Nice and easy. Sure. And you have to make a motion to approve them.
We found them in quality, so.
Okay.
Thank you.
My son.
Sure. Thank you.
How do you on the board go to the next meeting? I thought that was the go.
I don't want.
Usually we went to the
No, I do want to be there if they don't have it.
Like, yeah,
Whoever.
I think we'll,
Someone
I think I'm on that one potentially.
Yeah.
Another 5 year, I will pull one of the, let's refer to the.
See, that's
email.
actually,
I have someone who's hearing
What's
what
that?
all is being discussed.
There's the sheet in there.
yeah, the front,
The
under the sheet, yeah, under the front. Well, yes, that one, but under the front, the first tab, then on that other side is kind of like the cheat sheet.
Right.
Everything. Nathan, it's you, me, and Carrie rotating that will go to joint
Yeah.
conference quarterly.
Right.
Yeah.
I think med-staff needs my part.
I think they do, and I don't know.
I went
if-
to the last one
Someone
and
told me that that was, I think every med-staff.
I don't know.
Okay. We could talk about that more later.
Alright. Kim, do you want to save these for Ann to sign? You can sign them in her place, yes. But you still need a motion for them. Okay. So looking for a motion to approve credentialing for Dr. Kwong Vu and
Zimmerman.
Ed Zimmerman. No, it's you, Ed's. Oh, ND, so Dr. Ed Zimmerman.
Okay, I'll move that we approve the credentialing for Dr. Boo and Dr. Zimmerman.
I second it.
Any discussion? All in favor?
Aye.
Aye.
All right. Okay, on med staff, we had some pain management docs Zoom in, and so the providers were able to ask some questions and they, were given some answers. We're gonna get a little bit more information from them, and see what we can do with them in the future. Let's see here. Pharmacy, they're gonna take gastrogafin, off the formulary. Radiology, radiology deconstruction is going well. I believe you can get started next week.
Wow.
On the nursing home, there's 40 residents with a possible admin 2 to 4 weeks, at the time. There's 3 travel nurses, CNA, sorry. Home health, Allison started, in June, so that's been a big help with them. Infection control, no new real issues. And then just kind of a general overview of quality. We met this afternoon. We had 22 events in April. Our patient satisfaction surveys that were sent were down from this last month, just because we were having some staffing opportunities, challenges, and that's so the surveys that were sent were down. We're seeing an uptick of COVID in the community, so just be mindful of hand washing and all of that good stuff. Home health is working on med recs. There just was one issue that they came across, and then a continued issue with patients being discharged from the hospital, medicine's not transferring over to the current med office for home health, so they're not really talking to each other, so maybe figure it out. I met with pharmacy yesterday, and we added a whole bunch of performance measures that we're gonna start tracking in pharmacy, trying to get ready for the new packager to come. The biggest portion of that, I would think, is barcode scanning. Just making sure that all the barcodes for the medicines are scannable within pharmacy so that it transfers to scannability out on the floor for the acute care nurses. We found that there's some myths that the acute care nurses are using that aren't scanning properly, so they've been keeping track of them and sending it into pharmacy for fix. So that's probably the biggest one right now that we're working on together. And then Kathy kind of touched on some of the payroll stuff that's been going on. We're hoping to have it fixed this next pay period. This current pay period will be fixed on this paycheck. ADP's been working diligently with Nationwide and HSA and all of that. So we're hoping to have that fixed in place.
So I have a question about the pain management thing. I don't remember ever hearing at the board level why that started, why we're doing it.
I think they invited themselves here a little bit, and
They were at a meeting, one of the physicians. They were at a
Yeah.
meeting.
Yeah,
One of the first ones.
they were at a board meeting, they would like to start working here.
Well, right, but I'm not sure I want them working here. I don't remember ever being asked if we wanted to embark on this
well,
venture.
just so you know, the doctors aren't all that interested either.
Right.
So they pretty much said they're not interested in it, and so we probably will not be doing it. They pretty much said they're not interested in it, and so we probably will not be doing it,
Right.
because they don't want that.
Right, because.
And they'd have to be the referrers.
Right, because I spoke with some of our providers, and they said the proper way that we should embark on a new service is the clinic providers have to, they consider their patients to be like their family members, and they have to want to refer them, and in this case, they do not. And so, I just wanted everybody to be aware that this is probably not something we want to continue, and if we do, I'd like to hear some real discussion on why we're pursuing it, but, before we move in.
I think it's a done deal. The providers don't want it,
So we're not,
yeah, I mean, Kim said that, but I don't know if you were at that.
I wasn't at the
You weren't at that meeting that time, and they pretty much said no, and that was the first time I had heard of it. And really, they're looking to want to do things like injections where we don't have the equipment in radiology
Right.
to be able to support that sort of
Right.
situation, and we'd have to have a lead room as well, so we're talking about a lot of money.
right.
Yeah.
So, but I just heard about it at the med staff meeting,
Right,
so that's why you haven't heard it from me.
right, right.
Yeah.
Okay.
I did forget to mention, I hope I can do this real quick. Dr. Haberly and Dr. Blanchard are both scheduled to start working the 15th of July.
Right.
So we'll have two providers in the clinic.
So I know Dr. Haberly was gonna work 3 days a week.
Mm-hmm.
What's
5 days a week,
Dr. Blanchard's schedule going to be?
Monday through Friday.
Great.
Yes.
I do think we should definitely, as soon as those are signed and dotted, to get that out, like on the website and whatever, so that people start to know about
Yeah.
them in the community.
To do a big, huge, yeah.
I knew you were working on pictures and stuff, you said. So.
Yeah, we're working on pictures, and Dr. Haberly wanted me to add one sentence to his contract,
Yeah.
so I'm going to do that, and then he will sign it, and
Good to go.
then we'll be good to go. But until the ink's on there,
Yeah, right.
right?
Right, we don't want to put it on
Yeah.
Facebook until.
Okay, so today is the 11th. So-
Yeah, he's good. I told him he could even
Everything's
sign it
fine.
on the 15th
Okay,
if he wanted to, but all I'm doing is adding his vacation time accrual on there. So, because it wasn't in the contract, so.
oh,
I talked to Allison about it.
Okay.
Perfect, Bill.
Okay.
Wonderful. Any more from quality? I just maybe wanted to touch bases with you guys. We had a good discussion on our swing beds. We talked about the process of how swing beds come in. So what happens is Monument Health puts a referral in. Deb takes a look at it. She takes that referral, and she takes it to PTOT. They look at it, they make a decision, and then once they make a decision on the patient, yes or no, it goes to the medical provider. They take a look at the referral and they say, yes, the patient's appropriate, or let's give them a few more days and see what happens with them. And then once we get the full approval, we bring them on in. So I'm making sure you guys were aware of that process, so. That's the process.
And they're usually from other hospitals.
Yes.
They can get referrals from all of the surrounding.
So how far away do we typically look for? Just sort of like Rapid and Gillette?
As far as looking for them, probably if we were to call facilities, it would just be Rapid, Gillette, Casper, maybe Denver, but, people that come here typically have families in the area. They don't typically want to come here, if their family lives in Denver even, but there are situations where, other facilities are full and we have taken them from, greater distances.
Okay.
I know during COVID, we were taking them even from Denver.
And you said Billings sometimes too.
Yeah.
All right, quality committee.
This is you. I'm pretty sure you were there too. Well, Kim's actually probably gone over most of it because we just met at 3:00 today. So, yeah, she pretty much went through, I don't know if there was too much other stuff. I think they've hit on pretty much everything. I'm trying to see if there's anything that either Kathy or Kim didn't talk about. Not really.
All right.
We have 38 residents in the manor currently. 2 rooms open, a third, 2 plus 1 probably open. And so.
And then there's one on the waiting list, right?
Yeah, 1 from intermediate swing bed here waiting to go there. Yeah.
Good job.
That's about, I think you guys covered everything else already in other reports, so.
Awesome. Thank you very much for that. Next on the agenda is to move into executive session. Does anyone else have anything to add before we do that? No?
Thank you for responding. Thank you for what you
Thank you
do.
for coming.
Yeah. Thank you for coming.
I appreciate it. Appreciate it.
Yeah, we need a motion, but do we want to take a little 2-minute break, 5-minute break? before we do that?
Do you want?
Can you do the motion first?
Well, let's take a break and then go into.
Okay.
You need
You declare we're going.
need a motion.
We're we're taking a break and then we're gonna do the motion.
5-minute break.
Okay.
Do you think we can take breaks?
Yeah, you sure can, but this is gonna be recording the entire time. You can take the break after the motion too.
Oh, right, okay, yeah, that makes sense. Thanks, Jerry.
I did. You said, thank you. I'm gonna steal a sandwich. You're still.
For his recording.
13 more days. In all honesty, that's all I got, 13 more days.
Do you want me to clear it for you?
Otherwise, they'll just sit there for 5 minutes.
I have 3 minutes. I know.
So if that.
Hey, turn his camera off, say we go to executive session.
No,
well,
I
think
won't
he'd
do
like
that.
to- I think he'd
Okay.
like to watch us.
I don't, it might make sense for you, but it don't make much sense for us to do
That's
that.
fine.
So I move we go into executive session.
You
Have a
gotta,
second.
you need
You
to,
got me to read the whole
and
thing.
you can't go first.
I don't know.
I move we go into executive session to consider the appointment of a professional person.
You gotta read the state statute.
Okay, I'll start over. I move we go into executive session pursuant to Wyoming statute 16-4-405, subsection A, subsection 2, to consider the appointment of a professional person and
Subjection 9.
receive information classified as confidential by law.
I second the motion.
Any discussion? All in favor?
Aye.
Any opposed? All right, we are in executive session. Just for you.
That the CEO, he was building a case for Piper allergen removal. There was no doubt that was revealed in that meeting. Was working with personnel from H&H Leadership Solutions to do that. So this situation now, who knows what information gets uncovered with an active, aggressive, targeted investigation with a purpose. You can generate information about people. You don't know if it's true. You don't know if it's valid. But if you have that information, you can't let people go back to work. I know nothing. The board's done a good job of not telling anybody anything because this is a true sticky personnel situation where you have to be very careful for Piper's protection because God knows what's been said about her or turned up about her. But once those things are said, you have to investigate them. And so the board's in a position where they have to follow through on that and bring closure to that.
We are back in regular session. We are back in regular session at 9:26. Is there any further issues to come before this board? Hearing no further.
No decisions were made.
No decisions were made in executive session, and hearing that there's no further issues to come before this board, I will entertain a motion to adjourn.
I move that we adjourn the meeting.
Do I have a second?
I second it.
I seconded everything today, Chair.
Seconded by Ted Ertman. All in favor?
Aye.
Any opposed?
No.
No. All right.
You guys have been here a long time. today.
Thank you all for coming.
Thank you.
Thank you. Thank you
Yeah.
for everything you're doing.
Yes.
Thank you, Denise.
Thank you. Good night.
Thank you, Allison.
I will definitely take it all in, guys. So.